talking politics, cats and dogs, talking politics, cats and dogs, talking politics, cats and dogs.
Warning, the foreign content you see is asking the skit. So, I don't know what. Insert smiling here. Oh my gosh, my teeth! I need to find a dentist, but I don't want to go to the dentist. Sir, did you say that you wanted to go to the dentist? No. But my teeth are very unclean. Maybe if you just brush your teeth, brushing your teeth will clean your teeth. So, when you go to the dentist, they don't have to do any bad stuff on you. The next 300 nights later. Oh my gosh, my teeth, they're so clean. Let's see those teeth. And sort of like sparkling clean. Holy moly, that's so great. Hey, so now, what did you learn? That I don't have to go to the dentist. Yes.
So this story starts out with one of my Facebook friends having a very bad medical episode that was preventable, but they were in dental desert. They suggested I do an episode about dental deserts leading to worse outcomes down the line. And this was a great idea because I have personal experience with this topic since about 8 years ago. My older son needed pediatric dental surgery, and we had to travel from our large metropolitan area to a regular-sized town about half an hour away, but outside the service of public transportation, which was a problem because that's how we got around. Both my husband and I have both waited out an outrageously long time to have teeth pulled because of insane waiting lists and the inaccessibility of most of the locations we could have had that procedure done. This is a topic that affects a lot of people and can really destroy people's quality of life. So my first step on this topic was to search the internet, especially the boring part of the internet, where the government explains what it actually does in the same writing style that college students who got drunk the night before and didn't do any of the reading used to write a really long paper. Or in other words, they use a lot of words to say not that much. I also use YouTube videos made by business planners and dentists to understand how dental practices are set up. And frankly, if you want to skip most of this video, the very short answer of why we have this problem is capitalism doesn't solve the problems the way we think it does. In general, a lot of what we are getting out of our taxes is the government creating incentive programs to tweak profit motives in a way that will set up a system that will be somewhat functional and cover everyone, because even the most pro-capitalism people understand that if we leave the system to cover what will be profitable, a lot of people won't get any dental or healthcare coverage, and it'll make America look really bad on the world stage. To some extent, this does happen. That's why dental and medical deserts exist, especially if you have Medicare and Medicaid. There are 3 categories of dental jobs, and those are private practice, which is the setting most dentists work in. There are dental service organizations, or DSOs, which are corporations that dentists work as employees for. This is growing, but still only about a third of the industry. And then there's a very small sector of dentists that work for the government, and this would be jobs like the military and prisons, and they are usually paid the least. The issue with most dentists being in private practice is that those dentists will know a lot about dentistry from 6 to 8 years of school, but they will know nothing about business, and they will have to go right into running the business side, and they'll need to convince a bank to give them a loan for a small business when they already have a lot of debt from dental school. The easiest solution is to get a business location that is inexpensive, which means it's probably not going to be open, which means they are probably not going to open their dentistries in very urban areas where the rent is going to be very high. They are not going to be in well-trafficked areas with easy public transportation access, because again, that's going to be expensive to rent. They're going to set up shop in the less desirable, out-of-the-way office that has the cheapest rent they can find, because that is going to make their business plan look more viable to the bank giving them a loan. The only role the government plays in this is the state granting licenses to oral healthcare providers, defining the scope of services for providers, deciding on supervision practices, and creating parameters for practice ownership, size, and configuration. That role of the government does almost nothing to ensure that people have the opportunity to access adequate dental care, and some may consider the parameters put in place to be barriers for new practices. Now, the government probably recognizes that this is not good enough, so they do have a plan, and it's a great plan if you have dangerously low blood pressure and need it raised from anger. According to the website health.gov, which is the website of the U.S. U.S. Department of Health and Human Services. The plan is states can increase access by authorizing traditional and non-traditional providers to provide dental care. Traditional providers, dentists, dental hygienists, and dental assistants can work alongside non-traditional providers, primary care physicians, pharmacists, community health workers, and social workers to maintain a robust and comprehensive oral health care system. Now, I've seen primary care physicians say they can't explain a cranial abscess on an MRI scan because that's something that has to be done by specialists. So my educated guess is they're going to say the same thing when it comes to dealing with dental problems. And I have a degree that would allow me to do social work if I passed a test. And I can explain the cultural nuances of the tale of Genji to you, but I know nothing about teeth. Now, even if you don't have issues of access, there's another hurdle, and that is paying for dental work. The Affordable Care Act mandated health insurance plans for children to include dental care, but it's not mandated for adults. For adults ages 19 through 64, 59% have private dental benefits, 7.4% have dental benefits through Medicaid, and 33.6% have no dental benefits. Well, roughly 2/3 of the country having dental benefits is actually more than I expected. A third of the country not having dental benefits is very bad because our population is over 332 million people. And so it works out that over 110 million people don't have coverage, and actually only 14 countries have a population of over 100 million. So to put that number in context, we actually have more people who don't have dental insurance and are therefore may be highly reluctant to go to a dentist than most countries' total population. For the people that do have dental insurance, they can still have issues paying for dental work because insurance often covers up to $1,500, which is the same coverage that was offered when these programs were started in the 80s, which means that many people will have out-of-pocket expenses that they can't necessarily afford. Dental care access and affordability has been an issue in people's lives for a long time, but it's not a political topic the same way medical care is because a lot of people just suffer through the pain because they figure it won't kill them. Getting dental care seems like kind of a luxury service to a lot of Americans. Unfortunately, sometimes lack of dental work can kill you because serious oral infection can lead to a condition called sepsis, where bacteria enters the bloodstream and it can travel to your heart and inflame the blood vessels and cause blood clots. It can also lead to a more deadly form of meningitis, where the bacteria can move into the spinal cord in the area around the brain. The Mayo Clinic says that oral health might contribute to various diseases, including endocarditis, cardiovascular disease, pregnancy and birth complications, and pneumonia. Conversely, your oral health can be negatively affected if you have diabetes, HIV or AIDS, osteoporosis, or Alzheimer's disease. Some states have tried to increase access to dental care just by relaxing regulations, and this does absolutely nothing for the patients that can't find a provider because they're on Medicare or Medicaid, because most dentists don't accept those plans because what they pay per procedure is much lower than normal dental insurance, and many dentists feel like they won't be able to cover the cost of running their practice and their debts with what the government offers them to work on these patients. No matter how many dentistries are open, these patients still won't get service because dentistries don't have an obligation to the public, and they're business and they need to be solvent and make money. There's also a concern that loosening regulation can lead to worse outcomes because the American Dental Association already leaves a lot of room for dentists to decide how to run their practices, and there are dangers associated with getting dental work done. Well, it's not caused a statistically significant number of deaths. There have been deaths that lead to negligence lawsuits where a patient has choked on dental gauze during procedures where they are anesthetized and therefore did not have their normal protective reflexes. These deaths may be preventable using the method of tying dental floss around the gauze used in surgeries to ensure that it can be tugged out if it becomes lodged in the throat. These may not be common lawsuits, but people are already reluctant to go to the dentist, so this adds to the public mistrust of the profession. The general dislike of the public for the dental profession does affect the mental health of practitioners. I found contradictory claims about the exact ranking, but dentists do have a very high suicide rate. Dentists have a physically demanding job, and since most of them work in private practice, they get paid by procedure instead of having a reliable salary. They have mental health stressors that most of their patients tell them that they don't like going to the dentist or even personally dislike dentists. People go into the profession expecting steady hours and high pay, and while most of them still make a good wage, how much the insurance companies pay for dentists has remained stagnant, while the cost of education, equipment, and the cost of living has skyrocketed. So the longer they stay in the profession, the less desirable a job it becomes, but they're locked into it because of their debt from school and business loans. It's a very depressing situation to be in, and there really isn't a lot of resources for the unique stressors that cause a lot of people in the medical and dental professions to take their own lives. I can't say I personally understand these stressors, but I can offer a unique resource. If you're in a medical profession and you are concerned about mandated reporting by calling a hotline or talking to a trained professional, you can always contact some of your local churches and someone will be able to work around your schedule to talk to you. Even if you're not religious, it's still a resource that's available to you, and you may find people who really understand what you're going through. Well, this isn't the most common way that people lose their dental access. It's definitely the most tragic and preventable. As for the other problems that cause dental deserts, none of the tweaks the government has suggested is really going to do anything. How well medical and dental are supposed to work cooperatively together when they have completely different systems, and any referrals would have to be approved by the insurance companies. Medical professionals and dentists are under pressure to see patients as quickly as possible to maximize profits, so before any cooperative effort can be implemented, we would need some kind of measure that would allow both of them to have longer visits with their patients, which really isn't possible under a profit-driven system. The only interference the government can offer is more regulation, which will most likely discourage people from taking on the massive debt it takes to enter the profession. We could offer grants to help people have less debt from medical and dental school, and we could raise the rate we pay for procedures under Medicare and Medicaid, and those steps could help incrementally. But also, we're not going to do them. And we're definitely not going to do socialized medicine, so I don't see very much being done about any of these problems in the future. But if you have suggestions, your legislative body probably doesn't want to hear about them, and that's the reason you should annoy them. If they get paid by the taxpayers, they should earn that money. Brush your teeth and make sure you vote.
Man, your teeth suck. They look dirty and they have little trash in them. I have a friend that's a doctor. I think I should schedule an appointment for you. Dentist! My worst meal! Ah! Dude, why are you afraid of dentists? Oh, well, I'm calling him. Hi, it's me, Jimmy. I'm the dentist. Food! Wait! It's okay, this will only hurt a bit. There, all teeth is fixed. No, I'm gonna die. No. So he died of healthy teeth then.